have prepared for you.
Okay, so the next task we'll be looking at the heart failure, pulmonary edema scenario, okay? Heart failure causing pulmonary edema. In this case, what's the presenting complaint? Again, doctor, have shortness of breath. This is why I had mentioned you need to know some few differential diagnosis of shortness of breath that you need to be asking, okay? Or sometimes dizzy. Doctor, I'm feeling dizzy. Why there is dizziness? There's a heart problems, yeah? Doctor, I'm feeling dizzy. Okay, is there anything else bothering you other than dizziness? I'm also feeling short of breath. Since the patient is talking, the airway is patent. Same approach, because the patient is feeling unwell, okay? I'm feeling dizzy. Dizzy is a serious symptom, yeah? So somebody feeling dizzy, we need to go ABCDE. So since the patient is talking, the airway is patent. Let me look at your monitor. Oxygen is low, respiratory high. Gonna give high flow oxygen. Same story. Take a history. What's the presenting complaint? Dizziness. When the dizziness starts, came on suddenly or something gradually building on. Any other problems, any shortness of breath, any palpitations, okay? So the patient, you need to be asking other symptoms, chest pain, palpitations, shortness of breath. Yeah, the differential diagnosis as usual, and the rest of the stuff, you look at the wristband. Okay, there's a dizziness for the last 6 weeks, and also shortness of breath, especially on exercise. Okay, but nothing else, no another past medical history. Then if we're gonna go examine the chest, what do you find? There is crackles, especially on the bases, bilateral crackles. There is nothing gonna manage immediately to take away the crackles. It's not a whiz, but you're gonna need a chest X-ray and an ABG. When you come to circulation, the blood pressure is actually normal. Okay, the heart rate is high. The monitor shows an atrial fibrillation. Then you're going to have to check the pulse because the monitor shows an atrial fibrillation. The rest of the assessment here is okay. You need a full lead ECG. You always need a full lead ECG, even if everything is normal. We don't need an abdominal now, so we're going to do this at what stage? On E. Okay, we will do this at E. Okay, so we're going to put an IV line, come to management of circulation, send the routine blood test. Again, we're going to mention it's a full blood count, UNEs, LFTs, glucose, CRP, clotting screen, all of them. Okay, then give IV fluids, you fail. No IV fluids, just IV cannula, send the blood test. What happens if you give IV fluids? The pulmonary edema worsens, patient stops responding, he becomes unconscious, you have killed the patient, well done. Okay, so no IV fluids. Good. So IV line, send the bloods. Okay, what we do next, patient is talking to you. So on AVPU system, my patient is alert. Okay, PPU's glucose, normal. Now, I'll go back in here. What did you see on the monitor? An AF. What I tell you, a heart problems. So when you auscultate, what you're gonna do? You auscultate on all the 4 areas and carefully. Okay, the same thing we wanted to do in acute limb ischemia, but examiner says don't do cardiovascular. Here we examine all the 4 areas. What do you find when examining? There's a pansystolic murmur, loudest at the apex, but you can also hear it in all other areas. Okay, good. So when we come to D, as I was saying, patient is alert, don't do the GCS. People's glucose, fine, you can check, they'll tell you normal. Review the treatment. What treatment has you offered? You have only given oxygen, and saturations would improve. Still will remain relatively low because there is a fluid in the lungs. So don't think you're going to get to 97, 98% in there like you do in asthma and anaphylaxis. Okay. So don't keep on saying, I'm going to give more, I'm going to give more oxygen, I'm going to give more oxygen, and wanting to make it normal. That may not happen. Okay. Good. So now we examine the E. Okay. Going to look at the abdomen, inspect, palpate, look at the external genitalia, look at the lower legs, palpate for DVT and everything else. So what we're going to do next is further management. It's discuss management with an examiner. Examiner may ask only one question. Can you tell me all your findings on this patient? Can you tell me all your findings on this patient? Try to organize yourself in terms of ABCDE. So on assessment of the patient, okay, on A, the airway was patent. On B, the patient oxygen was low. Okay, examination of the chest, bilateral crackles, especially on the bases. On circulation, the blood pressure was normal. The monitor shows an atrial fibrillation. The pulse was irregular. You have to examine the pulse. On auscultation of the heart, there was a pansystolic murmur, which was loudest on the apex, but you could hear on all the 4 areas. Yeah, audible on all the 4 areas. Okay, good. So what you're going to do now? So what I would do is I will need to admit the patient under the medical team. The patient will need, I will send all the routine investigations, the bloods, the blood test, chest X-ray, ECGs. Okay, he will need a cardiology review. He will need further assessment with an echocardiogram. I will need, of course, to discuss with my seniors for further management of the patient. What the examiner might do, examiner might give you a chest X-ray and may give you an ECG, because there is a pulmonary edema scenario. So let me have a look in here. Okay, so examiner may give you a pulmonary edema scenario in here, put there for us with the fluid. So let's look at this. That's the pulmonary. Let me push this up. Try to zoom in. Sure. Okay. Now let's have a look in here. Look on my screen. So that's a pulmonary edema. So give you a chest X-ray showing, of course, bilateral fluffy. You see here, bilateral fluffy opacities. Yeah, that's a pulmonary edema. Okay. The examiner may also give you May also give you an ECG. When you say want to do a full ED ECG, we'll give you an ECG. What do ECG going to show? The ECG will have an AF, because you could see on the monitor already there is There's an atrial fibrillation. Okay. So what we have in here is an atrial fibrillation. Yeah, you can see it is irregular in here for us in lead 2. So examiner may give you a chest X-ray showing pulmonary edema. You may be given an ECG. Now, if these have been given to you in an emergency situation, what do? You manage. So you look at the heart rate is high. So I need to give you a rate control medication. Because there is a heart failure, I would give the patient digoxin, because it's a preferred rate control if there is a heart failure. Then I would also give the patient furosemide, yeah, the diuretics to treat the pulmonary edema. Do not just talk verbally. You have to look in the morning, you have to go in the trolley and find the medications, find the digoxin, find of course, and find the diuretics or simply the furosemide to treat this particular patient. Okay. But otherwise, to summarize, the patient needs, of course, a routine investigation. The examiner want to hear them again. He wants to hear all the findings. Yeah, that is, oxygen was low. There was crackles on the chest, on cardiovascular. The blood pressure was normal. The monitor shows an atrial fibrillation. The pulse was irregular, and there was a pansystolic murmur at the apex, but audible everywhere. And you're suspecting the patient has got what's a diagnosis. He has got mitral regurgitation causing left ventricular failure, leading to a pulmonary edema, and he also has got an atrial fibrillation. And how you would manage, I will take care of the ABCs of the patient. I will control the heart rate by giving digoxin, and I will give the furosemide or simply diuretics to treat the pulmonary edema. The patient needs to be admitted under acute medical team. He will need a review from the cardiologist. He will need an echocardiogram for further management. In the meantime, I'm going to keep monitoring the patient, and I'll take a second opinion from our seniors. If they'll suggest anything different from what I've just explained to the patient, then I will make necessary changes.